This is a review of the basic anatomy of the vertebral column, the spine. This is an adult specimen that is articulated. The disc between the various vertebrae are removed, and those intervertebral discs will, when in place, provide about a fourth more of the entire length of the normal adult spine. The spine, as you can see, is in the supine position. So this is the anterior surface, and this is the cranial end of the spine, and the very caudal end of the spine. In this supine position, you'll note that the anterior surface of the spine is more or less smooth compared to the posterior and lateral surfaces, which are more exaggerated with bony excrescences, and those bony tubercles, etc., are for the attachment of strong ligaments and muscles. Whereas the anterior surface faces internally towards, for example, the thoracic and abdominal cavities, and thus does not need to have sharp pointed edges. The sections of the spine are separated by the following. There's the first 7 vertebrae, 1, 2, 3, 4, 5, 6, 7, and these represent the cervical vertebrae, or the neck bones. The next 12 segments are referred to as the thoracic vertebrae, and these lie behind the thorax. The last vertebrae, these 5, right before we get to the sacrum and coccyx, are referred to as the lumbar vertebrae, and they lie behind your abdominal cavity. And then toward the end of the spine we see the sacrum, and the sacrum is formed originally by 5 segments of bone, 5 vertebrae, and these fuse, and some of the more proximal segments can still be seen to have rudimentary intervertebral disc. And then the very last part of the vertebral column is the coccyx. This is made up of 3 to 5 small fused coccygeal vertebrae and forms the tailbone. So the cervical region, again, is in the neck region. Thoracic region is just behind your thorax, and this lumbosacral region is behind the abdominal pelvic regions. As we rotate the spine and put this in the prone position, you'll note that we still see our cervical region, these upper 7 vertebrae, thoracic region, lumbar and sacral coccygeal regions. You also note, as I mentioned before, that the posterior spine has lots of roughened bony protuberances, bony excrescences, and these are allowing for attachment of strong ligaments and tendons onto the bone. We note that as you turn laterally, and in a general fashion, one sees the lateral aspect of these vertebrae, and one also sees that there are various foramina at the vertebral levels. And these foramina are referred to as the intervertebral foramina, and these allow the exiting of, for example, nerves, the entrance of arteries, and additional structures here would be meningeal sleeves that are covering the nerves, and venous structures that are going to and from the inner part of the spinal column. As you'll note, there is a continuous vertebral canal that goes down the entire vertebral column, and it's best seen on a disarticulated vertebra. So, for example, on this vertebra, this is the second cervical vertebra, one sees this vertebral canal. And within this vertebral canal, one finds the coverings of the spinal cord, for example, the dura mater, the spinal cord itself, nerve rootlets coming off of the spinal cord, blood vessels supplying the contents i.e. the meninges, that being the dura and arachnoid and pia mater, and the spinal cord itself. So, vertebral canal. We also see going up and down the vertebral column as we start posteriorly these very robust spinous processes. So these can be seen here at C2, all the way down, and even extending along the posterior surface of the sacrum. Protruding out laterally from the vertebrae, we'll see transverse processes. We see how in the cervical region these are a little less pronounced. In the thoracic region they become exaggerated, and then we see very prominent lumbar transverse processes. And then in the sacral region these transverse processes have fused, and we no longer see clear-cut transverse processes. You'll note that the first cervical vertebra, being unique as is the second cervical vertebra, the first has no spinous process. The spinous processes of the sacrum are fused in the midline, forming a median sacral crest. This is a nice view that shows you our small little transverse processes of the cervical region. And one interesting finding is that the transverse processes in the cervical region have a foramen through them, small hole. And through this small hole, the vertebral artery and its associated venous plexus and autonomic nerve fibers will travel. Interestingly, the seventh cervical vertebra also has a transverse foramen through its transverse process, but generally does not carry a vertebral artery at that level. The vertebral artery, that's the first branch of the subclavian artery, and the left and right vertebral arteries are important because together they supply about a third of the blood supply to your brain. The vertebral arteries, as they come off of the subclavian, will enter into the transverse process, usually of C6. And at that point, so the sixth cervical vertebra has an enlarged prominence of its anterior part of the transverse process, referred to as the carotid tubercle. And that carotid tubercle is a point where the overlying carotid artery can be compressed if necessary. So first cervical vertebra and second cervical vertebra are unique vertebrae in the cervical region and in the spine in general, and these are given special names. So the first cervical vertebra is referred to as the atlas. The second cervical vertebra is referred to as the axis. We can also call these C1 and C2. Then we have C3, C4, C5, C6, and C7. C7 is also given the name vertebra prominens due to its prominent nature, and it being one of the first spinous processes that one can palpate on the upper portion of the spine. T1 through T12 vertebrae are the names given to the following vertebral levels: L1 through L5, sacrum, and coccyx. So let's first look at some of the unique features of the cervical region. Number one is the transverse foramen that I've already mentioned as carrying primarily the major structure of vertebral artery. Number two is that if you look at the body of the vertebrae, right, the cervical vertebrae on their lateral margin have a small lip of bone that's seen here very nicely, and that lip of bone is called the uncinate process, and that coupled with the bony portion above is referred to as the uncovertebral joint. So uncovertebral joints in the cervical region between C2 and C3, and then down to C7. Occasionally the first thoracic vertebra will have an uncinate process as well. So uncinate processes, transverse foramina. These are some of the unique features that you find in the cervical region. As we turn laterally, we'll see that the intervertebral foramen, where our spinal nerve is exiting from the spinal cord, is lying in a small sulcus. And that sulcus in the superior surface of the transverse process has both an anterior and a posterior tubercle that are on either side, and these are for attachments of various muscles and ligaments. As we rotate posteriorly, you'll see the spinous processes of the cervical region, and these spinous processes can be bifid, as we see here in this third cervical vertebra. There's a little notion of that here on the fourth, and then we do not have a bifid spinous process on the remaining cervical vertebrae. The posterior portion of C1 does not have a spinous process, but rather a posterior arch. We see with, as in a general vertebra, that there's a lamina that is extending down on either side and then fusing here the spinous process. And you'll note that the posterior arch of C1 is the replacement for both the lamina and the spinous process of these remaining vertebrae. Here, between each of the vertebrae on the lateral aspect, we have the zygapophyseal joint, sometimes abbreviated facet joint. These are synovial joints between the lateral aspects of the juxtaposed vertebrae. So some special features of the first cervical vertebra. So we'll look at that. So the first cervical vertebra, or the atlas. This is the atlas here, this is here, this is the anterior arch of the atlas. And we have an anterior tubercle. And then comparatively we have a posterior tubercle on the posterior arch. So forming between the two arches and the so-called lateral masses of C1, we have a complete bony ring. If we look at the anterior portion again, you'll notice that the transverse processes are slanted down slightly. The superior articular facets here are articulating with the base of the skull above, the occipital condyles. This is a more normal shaped condyle, superior articular facet. And then here we have a so-called bilobed superior articular facet. On the anterior arch, you'll notice on the inside there's a small facet for the articulation of the dens, which is a cranial protrusion of the C2 vertebra that we'll look at next. On the posterior surface of C1, just behind our superior articular facets, we see a very distinct groove here and here. This is the groove for the vertebral artery. So the vertebral artery, as it's left the transverse foramen of C1 and prior to entering in intracranially, travels in this groove for the vertebral artery. So left and right vertebral artery grooves. We also see, as we go anteriorly, this again dental facet for the median atlantoaxial joint. We see a small tubercle on either side laterally and medial to the lateral masses, and this tubercle is for a strong ligament called the transverse ligament, or the transverse part of the cruciate ligament, which runs here to here and basically restrains the dens from moving posteriorly into the vertebral canal. If we look at the second cervical vertebra, this is the C2, or the axis. We see that it has a prominent feature. This is the dens, this tooth-like projection that protrudes cranially. You'll note that the superior articular facets are relatively sloped inferiorly. We see a body of the C2 transverse processes with the transverse foramen, as we've mentioned before, left and right laminae, and then we see a very strong spinous process. If we articulate C1 and C2, we see this type of organization, so that the dens is snugly articulating with the dental facet to form this median atlantoaxial joint. The transverse ligament would run just behind the dens here to ensure that the dens doesn't move posteriorly with various movements of C1, C2 and compress the contents of the vertebral canal, for example, the spinal cord. You also see that by having this relationship, this pivot around the dens and the anterior arch of C1, this allows the C1 to rotate, and with the cranium sitting above, allows some degree of the movement created when someone says no. So we've discussed some of the special features of two unique vertebrae, C1 and C2, the atlas and the axis. We've talked about some of the features in general for vertebrae, and the cervical vertebrae. You'll note that their zygapophyseal joints have somewhat of a slant. As we move down into the thoracic region, we see a similar slant to the zygapophyseal joint. And we also see a little more shingling of the spinous processes over one another, a shingling that's not seen here in the cervical region. And then the spinous processes in the lumbar region do not have that shingling effect. And you also notice that the zygapophyseal joints have now moved from this sloping anterior to posterior configuration to a more medial location facing each other. So with each vertebra, in general, for the general vertebra, we'll have a superior articular facet, an inferior articular facet, and each will articulate above and below with the vertebra to form that zygapophyseal joint. We'll notice going up and down the vertebrae there are many vascular foramina. You can see lots of potholes as we go along. The vertebrae are extremely vascular, and these small foramina will allow for vessels to enter the bone themselves. At the posterior aspect of each body, and we'll use the axis as an example, on the posterior body of the vertebrae there's a large foramen. This is called the basivertebral foramen, and that allows neurovascular structures to enter into the bone and supply the marrow space. For the transverse processes in the thoracic region, we see a unique finding. These are small little facets on the transverse process and on the bodies, and these little facets allow for the articulation of the ribs that are found generally just in the thoracic region. As we move down into the lumbar region, you'll see that the transverse processes become more elongated. You'll see that the spinous processes take on a more robust form and have a so-called hatchet shape to them. And then we move down to the junction between the lumbar vertebrae and the sacrum, the lumbosacral junction. And one feature here is the sacral promontory. As the sacrum is a fused bone, you'll note that it has intervertebral foramina that are fused, and these form anterior sacral foramina. And then if we rotate, posterior sacral foramina, again for the exiting of spinal nerves in their branches. Here at the junction, or the articulation with the coccyx, you'll see a small defect in the lamina and spinous process of the last sacral vertebra. And that is a opening into the sacral vertebral canal, referred to as the sacral hiatus. And again, that is accessing the long vertebral column. If we look at the sacrum close-up, from a posterior view, this sacrum has been sectioned multiple times to show some of the unique architecture. The first thing is we'll see the sacral promontory anteriorly. These are the ala of the sacrum. So you can imagine the fused transverse processes in this region. The fused spinous processes in the midline referred to as the median sacral crest. Here are the facet joints, or the superior articular facets, or processes for this sacrum. If we cut through at this point, hinge that over, one sees the vertebral canal, which continues on and out through the sacral hiatus. We also see the fused intervertebral foramen, and this allows at this point the dorsal rami of a spinal nerve, or the posterior branches, to exit through the posterior foramen of the sacrum, and the ventral rami to exit through the anterior sacral foramina.